Today we have 5 new cases of COVID-19 in Queensland, but they are all returned travellers in hotel quarantine. One had returned from Afghanistan via Dubai, and 4 in one family that had returned from Iraq, again via Dubai. We do have one new case in the community that tested positive in New South Wales, and therefore will be reported in New South Wales's numbers. They were tested on the 12th of July because they were a close contact. They'd been notified by New South Wales Health that they were a close contact. The details of what happened from then are a bit complicated, and I'm sure more details will come to light, and Dr. Young will outline this in more detail. It does appear that from that point, on the 12th of July, they should have been in isolation, and because they were in Sydney, they should have been locked down. It does also appear, though, that there was a lab error in the initial reporting of their test results. They flew from Sydney to Ballina on the 14th of July on flight VA1139. New South Wales Health is responsible for contact tracing all of the other passengers on that flight. They were then collected from Ballina Airport by the flight attendant that we reported positive in Queensland on Friday. She picked up that passenger from Ballina Airport and drove him back to Queensland. So it does appear that the flight attendant we reported on Friday caught COVID from the passenger on this flight to Ballina. Therefore, we would consider that the index case for this outbreak. Because that was the 14th of July, it means we're no longer concerned about those flights on the 12th and 13th of July, nor especially concerned about the risk in Gladstone, Longreach or Hervey Bay. That would now be a similar risk to the rest of the state, and Health will advise those passengers who had been in isolation of that outcome and those arrangements.